Hello, hello. Is this thing on? Thank you so much for the opportunity to be here today. This is an honor and a privilege for me. I am part of Team Gleason, Go Team Gleason, and this is really an important day for me, but also just that you're supporting this research and supporting scholarship and sort of these innovative ideas, I guess, as they say. Here's one of them, apparently. So um, I am a researcher who comes from a counseling psychology background, probably more grounded in qualitative research than quantitative, but I'd like to combine the two. I think it would be a beautiful sort of research design to explore these underserved populations, such as transgender people, in particular transgender elders. So you'll see TGNC stands for transgender and gender non-conforming. And this project is really a preliminary. This presentation is going to show you some preliminary findings when regarding the association between subjective memory complaints and their associations with discrimination in healthcare settings among TGNC elders. To start, I think just highlighting some key findings here to frame this brief presentation is important. So again, this is an extremely understudied and underserved population, and not just in research, but in policy and clinical practice. And our findings suggest, interestingly, that our cohort was pretty young, around 58 years old, and these elders are supporting or are reporting subjective cognitive decline at rates similar to cisgender peers about a decade older. So I think those rates came in around 16 to 18%. And that word cisgender, you may see that as you're perusing the literature in trans health, as one may do. It means on the same side. It means not trans. And I think it's an important label in some ways to sort of understand that trans is not a default in some ways. So language is important. Um, so we found that subjective cognitive decline is significantly associated with experiences of trauma, economic stress, being the target of violence, sexual assault, physical assault, based on one's perceived transgender identity. Interestingly, we did not find an association here in depression and subjective cognitive decline, but we do know that there are significant experiences and associations between subjective cognitive decline and the frequencies of discrimination experienced in healthcare or reports of. And that's concerning. If we've got a trans population that is reporting higher rates of subjective cognitive decline and sooner, it clearly will serve as a barrier if they're being discriminated against. It's a barrier to getting diagnostic services and care in terms of Alzheimer's and related dementias. So just a quick rundown of trans stats, I guess. Trans people make up about 1.4 million of the population. Elders, maybe 700,000. Now, this is estimated to be extremely underestimated. And part of that is fear of disclosure. And so we see here sort of a graph by the Williams Institute that breaks down trans identity as by age bracket, and we see as the age decreases, the level of disclosures are increasing. So that's really that could be a sort of a foreshadowing, right? As people feel more safe and there's more visibility, people are going to be reporting their trans identities. Another important aspect that this highlights is including space for trans people in your research. So we've got the boxes, one or the other, and a lot of times trans people are left out or sort of forced choice or maybe left out of research altogether. So if we don't ask, we just won't know. Why is this important? Well, again, there's not a lot of research in trans health, particularly trans elders. The research that exists is probably middle age mostly. And as disclosures sort of increase, our need to know about how trans people experience discrimination, experience resilience, and how this leads to cognitive health. So, as a side note, well, not really a side note, but along with the psychosocial factors, the literature that does exist highlights that trans adults have more physical risk factors for ADRD. So, diabetes, it's almost double the rate of the general population, hypertension, high cholesterol, mental health, and I believe obesity is at about 40%. So, you could take my word for it. You could take the Institute of Medicine's word for it. But also, Dr. Carl Hill says sex and gender minorities are a very important population, priority even. So when you see SGM, sex and gender minorities, and trans fits into that gender part. So our current aims were very modest. Examine the rate of subjective cognitive decline in TGN older adults, and then examine those factors associated with subjective cognitive decline. And this data comes from, well, first, the analytic sample is made up of 115 trans-identified elders, mean age 58, some college or higher. So this is a very educated and a very white cohort. Two glaring limitations, I think, in this project. So it'd be nice to diversify. And so the data here comes from the Rainbows of Aging module, which was part of this larger PRIDE study, really the first of its kind to longitudinally document the health of LGBTQ people. And Rainbows of Aging is specifically for people 50 plus. Interestingly here, some of the questions are modeled after the health and retirement study, which does not account for gender identity. So what we can do when their new data comes out, is we could take our numbers and sort of compare them to those numbers as well on those items. And that was done intentionally. Okay, so not a significant finding, but an interesting slide nonetheless. When we compare subjective cognitive decline, compare cisgender LGBTQ participants in our study with the trans elders, we see that the trans elders are reporting higher levels of port-a-fare and worsening memory in the past year. And these are significant factors in trans elders reporting port-a-fare memory, food insecurity, port-a-fare physical health, PTSD, violence, and discrimination in medical settings. With people reporting worsening memory, we don't see the same associations, but what we do see is that the discrimination in the medical settings holds true as a significant finding. And I think it's also just sort of poignant in looking at these numbers, at the rates of violence and harassment in public and PTSD that trans elders are reporting. It really is astonishing. I think PTSD for Vietnam era veterans comes in around 30%. And here we see, trans elders reporting 30 to 40%. And as a side note, trans people serve in the military at about 2 to 4 the rate of the general population too. So I think that's just an interesting statistic. This is my last sort of significant finding. What we did was, at the last minute, we compared cis LGBTQ people in our cohort with trans respondents, and we found that trans elders are experiencing discrimination in healthcare settings at twice the rate of LGBTQ elders. And so that is really interesting to think about. What would this look like comparing to cisgender or non-trans peers? Implications are far and wide. There's plenty of territory. It's a new frontier, and it's absolutely needed because Dr. Hill said so. And and so, thinking about future directions, I mean, a mixed methods approach would be a fantastic way to sort of capture the nuances in number 3, and then quantify with objective measures of cognitive decline as well, all together in the same study. But I believe that's my time. And again, thank you so much for allowing me to be here today to present.